Hi, I'm Dylan Wint. I'm the Las Vegas Legacy Neuroscience Education Chair at Cleveland Clinic Lou Ruvo Center for Brain Health. The Cleveland Clinic Lou Ruvo Center for Brain Health is dedicated to evaluating and treating individuals with degenerative brain disorders and also preventing those brain disorders from occurring. Let's talk about your brain and how to keep it healthy. Each of us has a brain that is one of the most amazing things that's ever been created. The brain controls the entire body. Everything we do, think, and experience happens in the brain. In fact, if you were to build a computer that could have all the processing power of your brain, it would take 10 megawatts to run that computer. What's a megawatt? Well, 10 megawatts is enough to power 1,000 homes. So, if you were to try and build a computer that could do everything your brain could do, it would take as much electricity as it does to run a whole neighborhood. There are so many nerve cells in the brain that it would take 100 years to count just a tenth of them. Translated, that means it would take 1,000 years to count them all. And these cells have so many connections that it would take 7 million years to count all the connections in just one brain sitting inside your head. Now, I said that the brain controls everything the body does. And if we think about the stuff that our body does, there are some things that are pretty easy to understand. For example, everyone raise your right hand. All right, good. Everyone close your eyes. Great. Now everyone slow down your heart rate. Not so much. How about trying to speed up your heart rate? Can you start sweating? How about you stop sweating? So your brain is actually controlling all of these functions as you're sitting there. If you get up and start to run down the street, your brain will tell your heart to beat faster, tell your lungs to breathe faster. It'll open up your blood vessels so that more blood gets to your muscles, and it will open up your heart valves so that more blood gets out to the lungs. Now, it's very important to understand that anything that's that complicated, there's the possibility for things going wrong. And in fact, things often do go wrong in the brain. So if you look at this brain here on the right side, you can see that there's kind of this big ragged hole there, right? That's something that's called a stroke. We talked about the blood supply. And when blood supply to the brain gets blocked off, the cells in the brain die, and you get a big hole in your brain. Now, in this particular person, the hole is in a spot that controls movement. And so this individual would have trouble with moving the other side of their body. There are other conditions that can affect the brain as well. So movement disorders, such as the most common one, Parkinson's disease, causes people to have slowness of their movement, shaking, or what we call tremors, and rigid muscles. You can also have brain damage from trauma, meaning an accident. So traumatic brain injury is when your brain gets hurt because you're in an accident, such as a fall or a car crash. Concussions, we'll talk about in a little bit, is another type of brain damage that's extremely common and something that we can actually work to prevent. Then there can be problems with memory and thinking, which are also really important facets of what the brain does. One very common disorder that occurs a lot in kids actually is attention deficit disorder. So kids with attention deficit disorder have trouble focusing and staying still. And it's something that can be treated with medication, but it is something that results from changes in the way that your brain operates. The most common disorder of the brain, though, is Alzheimer disease. This is a condition that really hits people when they're much older, and we'll talk a little bit more in detail about that. But first, I promise to tell you a little bit more about concussions. Well, how does a concussion happen? A concussion occurs if you get a blow to your body or your head that causes the brain to rattle around inside the skull. So, as the brain rattles around, it bumps into the skull, and that causes little bruises on the brain. And because the brain is bruised, it doesn't work right. It lets you know it's hurting. The way the brain lets you know it's hurting is that there are changes in brain function. And those brain functions, again, can be anything concerning your body. So people with concussions can get dizzy, they can have trouble sleeping, they can see stars, they can get headaches, they can have changes in their mood. So anytime you get a blow to the head or the body and you experience any of these symptoms afterwards, it's really important to let your family, your doctor, or your coach know. Even better, wear safety equipment so that you can avoid getting concussions. And it's good to watch out for your friends too. If you see them acting funny after getting hit in the head, It may be that they're suffering from a concussion. Now back to Alzheimer's disease. This is the most common brain disease. About 5.5 million people in the United States are affected by Alzheimer's disease, about 40,000 people in Nevada. By the time we get to 2030, and by the time some of you are adults, there'll be almost 8 million Americans with Alzheimer's disease. And Alzheimer's disease isn't just something that causes problems with memory and thinking, but it also causes death. In fact, it's the 6th leading cause of death, and it's expected to become the 4th leading cause of death within the next decade. Alzheimer's disease starts off slowly. It kind of sneaks up on people. So when they first have symptoms, they might have a little trouble with remembering things or coming up with a word or a name. They might have trouble with losing items around the house, or might get lost occasionally. And sometimes there'll be changes in behavior too. Folks might be a little bit irritable. That's the term that we use in medicine for when folks get angry quickly. Sometimes they'll be less motivated. That's something we call apathy. Or they can have a sad mood, which we call depression. It's not easy to tell that these changes represent a brain disease. Sometimes we just look at it as someone getting older. But if we were able to open up their heads and look at their brains, we would see that something is really changing there. On the left, you have a normal brain, and on the right, there's a brain with Alzheimer's disease. If you look down in the bottom corners there, you can see that the normal brain is a nice, healthy orange color all throughout. But when you look at the bottom right, at the Alzheimer's disease brain, you see these brown spots. Those brown spots are abnormal proteins that build up in the brain and are poisonous to the cells. They kill the cells, make it harder for the brain to function. And as they kill the cells, the brain starts to shrink. So if you look now in the top corners, you can see that the normal brain on the left looks kind of plump, whereas the one on the right looks kind of shriveled. That's because of the brain shrinkage that occurs as cells die. And brain shrinkage occurs in very specific places in Alzheimer's disease. So in that middle section there, you can see where the memory areas of the brain are especially shrunken down when compared to the person with normal brain. So as Alzheimer's disease progresses, it becomes easier to recognize that something really is going wrong. People will have very severe memory loss, so they'll forget things almost instantly sometimes. And sometimes they'll forget things that they've known for a while, like the name of a grandchild or their own address. Sometimes they'll struggle to communicate. So where they were missing a word here and there before, they might really have problems coming up with any words, or might be using the wrong words to talk about things. They might often need help to do very basic things, like brushing their teeth or feeding themselves. And often, they don't even know that they have a problem. The behavioral problems that start early on can also get worse as the disease progresses. So where someone was a little bit irritable, got angry easily before, now they might get really angry and they might go into rages. They can see or hear things that aren't actually there, or they can become very, very nervous because they're worried about what's going on inside them and around them. Alzheimer's disease becomes much, much more common as we get older. So you can be pretty sure that nobody in your class right now has Alzheimer's disease. However, if you're all going to live until the age of 85, you can expect that 1 in 3 of you will get Alzheimer's disease unless we find a cure before you reach that age. You can see those yellow bars represent how common Alzheimer's disease is as we get older. And the risk of having Alzheimer's disease doubles every 5 years after age 60. Right now, we have no way to tell who's going to get Alzheimer's disease and who isn't. We don't have any absolute way to prevent people from getting Alzheimer's disease. Most importantly, once it starts, we have no way of stopping it and we have no way of curing it. So you might be wondering, well, if that's true, what can I do about it? Remember I said there's no absolute guaranteed way to prevent yourself from getting Alzheimer's disease, but there are things you can do to reduce the risk of Alzheimer's disease. So all through life, starting even when you're young like yourself, until you're into your old age, there's this balance between things that are good for your brain, things that are bad for your brain. Things that are good for your brain will protect you from Alzheimer's disease. Things that are bad for your brain will increase your risk of getting Alzheimer's disease. Let's look at those in a little bit more detail. Probably the most important thing you can do is make sure to get plenty of physical exercise. Walking, running, bicycling, anything that keeps your heart rate up and keeps you moving, and you want to get about 30 minutes a day, so that comes out to most people for about 150 minutes per week. And you want to do a moderate level of exercise, meaning that you're huffing and puffing and you are too out of breath to sing a song, but you don't have to be so out of breath that you can't talk to a friend that you're exercising with. It's important also to exercise your brain. Keeping your brain engaged and active, learning things, creating new things, really helps to keep the brain healthy. There are lots of examples of people who had brains that were very active and healthy late into life, and it's pretty clear that it's because they kept thinking and doing and creating and working on their brains all through their lives. On the other hand, there are examples of people who didn't do the right things for their brains. So things like smoking or drinking too much alcohol, eating bad foods, they create problems for the brain. Does anyone know who those two gentlemen are on the bikes there? These guys on the bikes are the McGuire twins. And guess what they're known for? They set the Guinness Book of World Records record for being the fattest twins ever. Now, you see a couple numbers on their backs. Any idea what those numbers are? Nope, they're not their position jerseys from their football team. Those are the ages at which they died. So they probably had fun and they even got into the Guinness Book of World Records, but they died early because of complications from too much weight. Other medical problems can also reduce your brain health. Diabetes, which is a problem where you have too much sugar in your blood, can increase the rate at which your brain ages. Having high blood pressure also damages the brain. And weighing too much or too little can damage the brain as well. So you want to be sure to get your exercise, eat right, and keep your brain active. Now, what are these things on the top right? Any ideas? Right, they're cell phone cases. And how about on the bottom right here? What is this guy doing? No, he's not fixing the car. He's changing the oil in the car. He's maintaining his car. Now, why do we get cell phone cases and why do people change the oil in their cars? Because these are valuable devices that we want to make sure last for as long as they can. But just about every one of you through your life, you're going to have a bunch of cell phones, you're going to have a bunch of cars, but you're only going to have one brain. And the brain is the most amazing device or machine that has ever been. If you don't want it to develop problems, you want to make sure to protect and maintain it in the same way that you would any other valuable thing, because it's the most valuable thing you can have and it's the only one you're ever going to get. So take care of your brains and take care of your bodies.